Good day, everyone. I am Angelica Baltan and will act as a nurse.
And I am Alexia Nancina and I will act as a mother.
And we are a second-year student nurse. This video will show you information about the importance of breastfeeding, proper positioning, and attachment.
Breastfeeding can help protect babies against some short and long-term illness and disease. Breastfeed babies have a lower risk of asthma, obesity, type 1 diabetes, and sudden infant death syndrome or SIDS.
Performing effective breastfeeding technique has been shown to be important to establish breastfeeding, to ensure milk transfer and to prevent breastfeeding problems. In the correct position, your baby will be able to suck, swallow, and breathe comfortably. If your baby's nose appears to be blocked, move their bottom closer to you. This will create a head tilt and free up their nose. The deeper the attachment, the good or comfortable you will, and the better your baby will be fed.
These are the proper positioning of breastfeeding. First is the cradle hold. Cradle hold is very common because it's easy and comfortable for a lot of moms and babies. Your baby has difficulty latching. This hold can help guide baby's mouth to your breast. Next is the cross cradle hold. The cross cradle hold allows you to have more control over how your baby latches on. Takes the breast into his or her mouth. Next is football hold. Football hold offers some of the best support for latching onto the nipple. It gives you an easy way to position the baby against your breast and a clear view of your baby's face, and it is used for the cesarean mother. And lastly, side-lying position. Side-lying breastfeeding can be a great way to avoid your baby putting pressure on your abdomen while breastfeeding, which can greatly reduce discomfort as you heal. Another way to position and latch your little one. The first position is the cradle hold. The cradle hold is the most common breastfeeding position. The mom's arm supports the baby at the breast. The baby's head is cradled near her elbow, and her arm supports the infant along the back and neck. The mother and the baby should be chest to chest. This position is cross cradle. Uses the opposite arm to support the infant with the back of the baby's head and the neck being held in the mother's hand. Her other hand is able to support and shape the breast if required. In this position, the mom can guide the baby easily to the breast when they are ready to latch on. This position is football hold. The baby is positioned at the mother's side with their body and feet tucked under the mom's arm. The baby's head is held in the mom's hand. The mom's arm may also rest on a pillow with this hold. This position may be advantageous for moms who have undergone a cesarean section. This is a side-lying position. The mom lies on her side and faces the baby. The baby's mouth is in line with the nipple. The mom may also use a pillow for back and neck support. So this is the proper latching of the baby's mouth on the mother's breast. Nipple and areola in baby's mouth. Watch for the wiggle, chin tucked to breast, nose close to the breast, and the baby parallel with the chest. Here are the common problems of breastfeeding. First is the sore or cracked nipples. Sore nipples usually happens because your baby is not well positioned and attached at the breast. Putting up with it could make pain or discomfort worse, so it's important to get help from your midwife, health visitors, or breastfeeding specialists as soon as you can. Low breast milk supply. When you first start breastfeeding, you may worry that your baby is not getting enough milk. It can take a little while before you feel confident that your baby is getting what they need. Offering your baby both breasts at each feed and alternating which breast you start will help you to stimulate your milk supply. So while keeping your baby close to and holding them skin to skin. Speak to your midwife, health visitors, or breastfeeding specialists if you're worried your baby is not getting enough milk. Breast engorgement. Breast engorgement is when your breasts get too full of milk. They may feel hard, tight, and painful. Engorgement can help in the early days when you and your baby are still getting used to breastfeeding. It can take a few days for your milk supply to match your baby's needs. Engorgement can also happen when your baby is older and not feeding so frequently, perhaps when they start having solid foods. Overabundant supply of milk. Occasionally, women make too much breast milk and their babies struggle to cope. It's best to get your midwife, health visitors, or breastfeeding specialists to watch a feed to see if they can spot why this is happening. They can also show different positions to help your baby cope with large amount of milk. Clogged milk ducts. If breast engorgement continues, it can lead to a blocked milk duct. You may feel a small tender lump in your breast. Frequent feeding from the affected breast may help. If possible, position your baby with their chin pointing towards the lump so they can feed from the upper part of the breast. Mastitis. Mastitis or inflammation of the breast happens when a blocked milk duct is not relieved. It makes the breast feel hot and painful. It can make you feel very unwell with flu-like symptoms. Then, it is important to carry on breastfeeding. Starting feeds with a tender breast may help. Breast abscess. If mastitis is not treated, or if it does not respond to the treatment, it can lead to a breast abscess, which may need an operation to drain it. And last, breastfeeding in tongue tie. In some babies, the strip of skin that attaches the tongue to the floor of the mouth is shorter than usual. This is known as tongue tie. Some babies who have a tongue tie do not seem to be bothered by it. In others, it can stop the tongue moving freely, which can make it harder for them to breastfeed. The good news is the tongue tie is easily treated. These are the proper positioning of birthing the baby after feeding. An important part of feeding a baby is burping. Burping helps to get rid of some air that babies tend to swallow during feeding. Not being burped often and swallowing too much air can make a baby spit up or seem cranky or gassy. Most important of all, a comfortable baby is a happy baby and will be able to play and rest better. The benefits of switching breasts while breastfeeding is to keep up your milk supply in both breasts and to prevent painful engorgement. It is best to alternate breasts, whether in the same feeding session or between different sessions. Remember to keep your baby on the first breast until it is soft and then move your baby to the second breast.
Thank you for watching, and we hope you learned a lot about the importance of breastfeeding and the proper positioning.